Hi, I'm Marvin, and welcome back to another Workflow Wednesday. And in this Workflow Wednesday, I'm going to show you guys how to set up a dual scan treatment plan on RealGuide. So right now we're actually in the administration phase, and one of the main things about RealGuide is that actually setting up for their dual scan process is actually a lot different than other treatment plan softwares. Everyone has their own way of doing it and how you set it up, but for RealGuide it is a more particular process. So I'm going to go over and just show you guys the first steps just to at least get to the point to start getting ready to treatment plan. So right now, as you see, we are in administration where you're going to be able to see all the different cases that you have already done in the past that are all saved, of course. But right now, of course, what we're going to do is we're going to go to the top left and we're going to add a new patient. So what you're going to do is you're going to add a new patient and you're going to go ahead and, of course, put the patient's name. So we're going to call it dual scan. And of course, what we're going to do is we're going to start off by importing the 3D exam/project. And as you notice, you're going to have your two basic ones to import the file or import the DICOM folder. So if you want to import an individual DCM or the actual whole DICOM folder that has all the individual slices. But at the bottom, you'll notice you actually have a third option that says double scan. That's the one we're going to want to click for this specific process. So you're going to go ahead and left click on double scan. And you're going to notice, depending on what arch you're doing, whether you're doing upper, lower, or both, you're going to go ahead and choose which one you're going to bring in. For us, this is going to be for an upper. So we're going to go ahead and left click on the upper DICOM. And you're going to notice you're going to get those same two options from before. Import file, import the DICOM folder. For us, we're going to import that DICOM folder. So you're going to go ahead and left click. It's going to take you to your directory. And now you're going to go ahead and find your CT scans. So for us, I have them here saved as dual scan. And as you notice, I have two different ones. I have the DICOM of the patient and I have the DICOM of the prosthesis. Of course, for different softwares, some you can bring in the actual scans of the prosthesis as STLs, but for this software and many others, we're going to have to bring it in as a CT scan. So again, of course, what this process is you're taking the actual patient's appliance, usually going to be a denture, and you're going to scan it on your CT scanner. So that's what we have. We have a scan of a denture, but it's in DICOM format, not STL format. Very important to remember, because if you have it as an STL, what you might have to do is you might have to print it out or make it in like a radio opaque material, and then you might have to then take it to a CT scanner, scan it, and extract it as a DICOM. So that is what we've done here. So we're going to go ahead and bring in our prosthesis. So you're going to go ahead and click on that folder and press select folder. As you see, it brought it in. For us, we're importing all the slices, so it is saying that we're importing 401 files. You're going to go ahead and press OK. You're going to press close right here at the bottom, and you'll notice we have right here, this is going to be our upper jaw. You can actually use this little bar right here and left click and drag it, left click and hold and drag it, and you'll start to be able to see what it is you brought in, and just in an occlusal view. But this is going to be what we want to bring in, so we're going to go ahead and press open. And now, again, the software is opening. And once the software opens, you'll actually notice that on the left side, we have a lot fewer options than what you do when you actually are doing a treatment plan. We actually only have 3 options. We have the VOI settings, the 3D settings, and the segmentation. Very important, all we're doing is identifying the actual denture and the threshold in which we want the denture to be when it comes to doing the design of the treatment plan and when it comes to designing the surgical guide. So right here, when it says, of course, VOI settings, you have this option in treatment planning. So again, we're not going to go too in depth about it. But again, if there's any data on it, you can go ahead and permanently trim it. Obviously, right now, as you see, what you can actually just see right now here is just the actual radiographic markers. You're not seeing the actual full denture. So if you want to see that, to see what you need to cut away, go ahead and go to 3D settings. Go to the volume options and go ahead and bring it to where you see the less dense areas and have that come up to where you can see the actual prosthesis of the patient. And then if you need to, you can go back to VOI settings, and of course you can go here, and this is where you can actually trim your CT scan. So if there's any scatter that was created from any other things in the scan, you can go ahead and definitely get rid of them. As you can see here, this is a very good scan of the patient's prosthesis, so we don't need to do anything here. We're going to go ahead and go to 3D settings, and now here that you have this, what you're going to do is you're going to get it to the threshold in which you want, just to make sure that you're not seeing any discrepancies, any holes, anything like that. This all looks really good. Of course, rule of thumb that we've said in even other videos regarding this dual scan process on any other software that we may have used, one of the main things is you want a minimum of 3 radiographic markers and set up and have it set up in a what I would like to call like a triangle format. So what I don't have is I don't have 3 set up on the left side of the denture, or 3 set up right here in the middle, or 3 set up on the other side. No, I have 1 on one side, 1 right in the middle, and then 1 on the other side. Again, in a kind of a triangle format. And then of course, if you do end up putting more than 3, to me, the more the merry. It's better to be safe than sorry. You never know if when you take this out of the patient's mouth after doing the regular CT scan and you're putting it on the actual plate to actually scan the prosthesis, God forbid one falls. If that happens, all of a sudden you're going to have to re-put the markers and do it all over again. So sometimes more than 3 is better, but a minimum of 3 is what you need. Anything less than 3 will not work. But like I said, we're looking at our scan. It looks very good. So we're going to go to the very last step where it says segmentation. Go ahead and press OK. This is just about the storage. But as you see here, we have 2 options. We have our markers and we have our prosthesis. So this is actually a really good step because sometimes with radiographic markers, sometimes it can create a lot of scatter. And when you have a lot of scatter, it can kind of hinder where you know exactly where that marker is. Sometimes a long piece of material will be made from the radiographic markers and you won't know where the radiographic marker starts and finishes. So very important to look at that. These radiographic markers actually look really good, very flat, so we know where they start and finish. So they look really good. So what we want to do is we want to segment the markers first. So we're going to go ahead, and if you come to this little dot where you can see the segmentation, if I bring it up, I can see the full denture. As you see here, sometimes scatter does pop up on these when you start looking at the less dense areas. Totally fine. But what we're actually segmenting is the markers themselves. So we don't want to see the whole prosthesis. We just want to see the markers. So what we're going to do is we're going to grab that little circle. We're going to left click and see the more dense areas. In these scans, the most dense things we're going to see are those markers, because those markers are radio opaque, so they're very solid of just pure radio opaque material that the actual software can see. So right now this looks really good. I know you see this little extra material back here. We're going to definitely get rid of that, but what you want to do is just see those markers. Don't go too far because you can end up taking some away or have something like that. Just get it to the point where they look nice and full and you can see them. Again, any extra scattered, don't worry, we will get rid of it. Once you've gone to the point that you like this segment, you like this threshold, go ahead and press segment. It's going to be a very fast process. As you see, it is now highlighted in yellow. That is what's segmented. And as you see, we do have some other parts that aren't the markers that were segmented. To get rid of them, just come here to the left on your 3 options that you have. You have remove isolated components. Don't do that one because all the components here are isolated. Nothing is really touching each other. Or you can go to smooth. Of course, we're not needing to smooth these, but we do want to cut by area. You could go to remove isolated components and click everything manually. That's totally an option, but I just go to cut area and I go ahead and highlight by left clicking and holding and going over the things that I want to get rid of. Oh, not like that. Don't do it like that. Let's deselect and let's do it one more time. So again, going over everything that's inside the purple is going to be cut away, deleted. So I have everything. I don't have any of the markers, as you can see, in that purple area. So go ahead and cut. And as you see, now we're left with just the markers. That is perfect. Go ahead and go to the bottom and press apply. So we have segmented the markers. Now we need to segment the prosthesis. So let's go to the bottom right here where it says prosthesis. Same concept. Move the threshold meter, but let's go ahead and move it until we see the full denture. So for this one, we want to see the less dense area. So we're going to go to the left and we're going to go until we see the denture. Again, as you can see, even on the facial of the teeth, if I go too low, it's going to start showing less dense areas and start adding some scatter. You don't want that. Get to the point where this looks like a very smooth denture. Don't take too much away either. Just like this, it looks very good. I'm looking around. We have a little bit of parts where it's like this, but that's totally fine. Most important thing you don't want to see is the intaglio surface to have any holes or any scatter, because that is the most important part, due to that's going to be what's used to sit on the patient's tissue. So you want a good representation of that tissue. Right now, we do have this at a very good threshold. So what we're going to do is the same as the markers. We are going to segment. Once segmented, you're going to go ahead and look if you have any extra data you need to cut away. There is none, so this looks really good. Right now, it's not raggedy at all, so you don't need to smooth it, but if you would like to, you definitely can. You can go ahead and choose smooth, and you can even up the strength. I don't think this needs to be, so I'm not even going to smooth it, but if you feel like you want to, go ahead and go here, up the strength if you want to, press smooth, and it will smooth the whole scan itself. I don't think that it needs to be, so I'm going to move forward and press apply. And as you notice, once you've done that, there's nothing else to do, which is perfect. We're going to go ahead and just press finish. So pretty much in that process, what we just did was we took a CT scan and we identified what we wanted from those CT scans to become our meshes. So that's what we did. So now what you're going to do is, still on this same patient, you're going to come back to where it says import and create. You're going to left click again. You're going to go again to where it says import 3D exam project. And instead of clicking double scan, you're just going to go ahead and bring in the patient's prosthesis scan. So we're going to go ahead and go to import DICOM folder. We're going to find our folder again. And this time, instead of actually choosing prosthesis DICOM, we're going to choose patient DICOM. Go ahead and select that folder. Let it load in. And once it's loaded in, just like the other one, it's going to tell you all the slices that you have brought in. We've brought in 501 files. That is, of course, going to make up the whole CT scan. We're going to go ahead and press OK. We're going to close this, and you'll notice now we have two. We have the upper jaw, that if we went through this meter, you'll see it's the actual denture. And now we have the CT patient with markers. Go through it, you can actually see it's the full jaw scan, lower and upper. So what we want to do is, now you don't want to open the one up here that we started with. We want to open the one that says patient with markers. We're going to go ahead and press open. And of course, just like before, it's just going to open up the actual RealGuide software. And as you notice, we actually already have our scan of our denture here. And I can even get rid of it. And we have the markers as well, which is very important. So that process we just did was able to get us here to where when we brought in the patient's CT scan, we now have the appliance and those markers. So now what you're going to do is, just like the other one, you can go through the process of looking at the VOI settings. You can get rid of the lower if you would like to, because this is an upper plan. You can go ahead and cut away any extra data you don't want on the CT scan. All of that. But what we want to do is we want to go ahead and go to data import. Data import is going to show us all the objects that we've already brought in. So for us, because of the process we just did before, we brought in two different objects. We brought in an upper jaw and we brought in markers, or of course the upper prosthesis. So that is what's happening when you do those first steps that I just showed. So now, as you see here, again, what's really important and really actually cool about not only making a segment or a mesh for the actual prosthesis, but the markers, is because, again, for some markers, when I show the less dense areas, those markers start to create scatter. So for example, for this case, let's say that on this patient's prosthesis, these markers were creating a lot of scatter, just a crazy amount of scatter. You can almost see it in this one on this left side. It's actually pushed out a little bit more, but if we look at the markers, look how flat it is. That's because we're showing less dense areas. But for this one, it's not too badly pushed out, so it really shouldn't cause any problems with aligning. But let's say that you are a little nervous that it will. You can actually align these markers first and then align the appliance to the markers, just to make sure you have a very precise alignment, kind of like a two-step alignment process. But for this one, we could actually, if we wanted to, probably even get rid of these markers. We don't have to use them, but it's always good to have them. But what we're going to do is actually just grab the prosthesis by left clicking, and once you left click it, you'll notice that at the bottom you have edit, matching, and Boolean operations. What we want to do, of course, is match this to the CT scan. So what we're going to do is going to go to matching. We're going to go to STL to DICOM because that's what this is now. We converted the DICOM of the prosthesis into an STL. So we're going to go STL to DICOM. Go ahead and press OK. And now you'll see we have the two windows. Here's your CT scan. Here is your prosthesis. And if we zoom in on the CT scan, you can actually see those markers, of course, are there. So now what we're going to do, of course, is you could do assisted, but the software might have a hard time of identifying the markers. So, of course, I would just go by points. And, of course, now we're going to go ahead and we're going to mark each one. So starting the same pattern. So if we're going to start on the one on this side, we're going to go left click here, left click here on the prosthesis. Let's go ahead and rotate and click that middle one on both images. So zooming in, left click here, and then of course, last but not least, the third marker on this side. Left click on the left, and then left click on the right image. Once you've had the three, you can go ahead and put fit points. And now, of course, just like whether you were doing this indentureless case or you're doing a tooth-borne single implant, very important that now you go through the bottom images that you have and look at the outline of the prosthesis to the CT scan. It does become a little bit harder to identify whether or not this is a good alignment, but if you look at the images, like for example this one, you can go ahead and go through the different slices and you'll see that it is a very good alignment. And one of the main ways is that when you get to a marker, make sure you can see that those markers are aligned with not only the outline, but the one on the actual CT scan itself. Of course, because this is a prosthesis, none of the white line should be, of course, impinging on the bone at all. There should be space there, but you can kind of almost see an outline of this patient's appliance. The only thing is, if you can tell on this CT scan, it was taken with a closed bite. Don't do that. Take it with an open bite, at least if you have to put a leaf gauge or anything like that. Anywhere from 1 millimeter to 2 millimeters of an open bite is going to assist us in aligning these and making sure that the alignment is proper. But looking at this, it is a very good alignment. So what we're going to do is just press apply. And now from here, since you have that, of course, this is a good alignment. So if I want to, I can either just hide these markers or I can actually come here and actually remove them. So it's totally up to you. I could delete the object, but it's totally up to you. There's nothing wrong with keeping them there. But now at this point, now you can go through the process and start treatment planning for this upper one as an indentureless case to be able to convert this denture into a surgical guide. That's it for another Workflow Wednesdays. If you guys have any questions, please comment below and we'll see you on the next one.